Hi, this is my infant wellness exam. Um, this is a 1 month well child examination on Penny, a 4 week old female infant that was born 38 weeks and 6 days gestation via spontaneous vaginal delivery, presenting today for her routine 1 month well child examination. Um, Mother reports no acute concerns today. Pregnancy and delivery were uncomplicated. The mother denies preeclampsia. She denies hemorrhage. She does state that she had an epidural, but she received routine prenatal care. Her labor was induced, and the labor only lasted less than 10 hours, and the infant had no complications at birth. There was no NICU stay required, no respiratory distress or birth complications at all. The infant is feeding well with a good latch and appetite. Mother reports that she is breastfeeding every 2 to 3 hours and there are no issues. She has good milk supply and she was educated on how to store the milk properly. She reports normal wet diapers and normal stooling patterns every day. The infant sleeps on her back in a separate bassinet without loose blankets, no pillows in the bed or toys. The infant is responding to sound, briefly tracks visually, and demonstrates normal newborn reflexes. I will now begin the physical examination. So, just general appearance, the infant appears to be alert and awake and is consolable and not in any acute distress. The skin is warm and pink, and she appears to be breathing without any accessory muscle use, so there are no signs of respiratory distress. Her vital signs today 98.4 degrees Fahrenheit, axillary heart rate was 140, and respiratory rate was 38 breaths per minute. So I will start the exam checking her head. So we'll have the infant on her back. Okay, so we'll check her head. So we'll check the anterior fontanelle, posterior fontanelle. They're both soft and flat. We check the sutures. So sutures appear intact. They're not overriding. And her sagittal suture is along the top midline of the skull between the parietal bones. The coronal sutures are palpated from ear to ear, separating the fontanelle and parietal bones. The lambdoid sutures are palpated along the posterior aspect of the skull between the parietal and occipital bones, and there's no separation or overriding of the sutures. Her eyes will use a pen light. The pupils appear equal, round, and reactive to the light, and there was also a red reflex present in both eyes. There's no redness in the eyes or no injection or drainage noted. For her ears, we're just going to look at the ears. They are in a normal position, not low lying, and there's a normal appearance bilaterally. And the infant responds appropriately to sound. For her nose, we just look inside the nose. The nares are bilaterally patent, no congestion or obstruction, and the infant is breathing comfortably through her nose. Um, Now we'll look inside of their mouth and we'll see that it is pink and moist. The oral mucosa, there's a hard and soft palate that's intact, and we'll be checking a sucking reflex inside. So there's a strong suck reflex, and the rooting reflex is also present. Also, at the same time, I am assessing her neck, and the neck is supple, there's no masses, and no lymphadenopathy. Now we're going to check her clavicles. So the clavicles are being palpated. There's no crepitus or deformity. We're also going to check muscle tonicity since we're up here and it is equal. And we're checking brachial pulses right here. Okay, they're +2 and equal bilateral. We're also taking a look at her chest and abdomen. Her chest, as I said earlier, you can tell that she is breathing unlabored. There's no retractions, there's no nasal flaring either, no grunting, no accessory muscle use. I will be taking a listen to her heart and her lungs. So we listen to the lungs. Okay, taking a listen. And lungs sound clear bilaterally. There's no wheezing, no crackles, no adventitious sounds. Now we're going to take a listen at her heart. Okay, and heart rate sounds regular, and it does sound like it's approximately 140 beats per minute. S1 and S2 are present, and there are no murmurs or gallops heard on auscultation. We did, or we are looking at her abdomen as well. Her abdomen does not appear distended. I will be listening to bowel sounds. We'll listen to all four quadrants. Okay. And these bowel sounds are normal active. There's no hypoactive bowel sounds or hyperactive. Now I'm going to palpate the infant's belly or abdomen. Okay. And it is soft, non-tender as well. We are also taking a look at the umbilical stump, and it's clean, it's dry, there's no erythema or drainage or discomfort even. Now we are taking a look at the infant's genital and anal openings. So we're going to look at the genital area. There's no swelling, no redness. Skin appears to have no erythema, no rashes either. We can also take a look at the anal opening. It appears patent, and there are also no rashes or erythema. While we're here, we will also check femoral pulses. Okay, and they are +2 and equal on both sides. Now, we're also going to check for hip dysplasia. So we will be doing two different maneuvers. One of them is called a Borlo maneuver, where I will flex the hips and we'll do one by one. We'll flex the hips and we'll make sure that the knees are and the to the hips are 90 degrees, and we'll gently adduct, so bring it inward, and then we'll add some pressure, and this will check for hip dysplasia, and then we'll do the same on both sides. Okay, no hip dysplasia noted, and we're also going to do the ortolani maneuver. So the ortolani maneuver will be the opposite, so we will abduct the hips and we'll apply anterior pressure, and then we'll do this side as well, and there's no hip dysplasia or anything that was palpable on both sides. So both of those were negative. Overall, the infant's skin appears to feel warm. She's dry and skin is intact. There are no lesions or rashes. There's also no jaundice really noted on the examination today. Now, I will also check the reflexes. So I'll check a moral reflex, and moral reflex is intact and symmetrical. Um, I will also check her hands, and the baby does grasp. And we'll also do Babinski sign. Okay, and that's also intact. Um, Overall, um, this is a healthy infant so far. Now we will place the okay. Now the infant is placed on her back. So we are taking a look at the spine, making sure that it does not have any deformities and it does appear straight. We continue to look posteriorly on her neck and we check the bottom of the skin at the bottom. Sometimes a Mongolian spot can be normal, and that is a normal finding on an infant. Um, and this concludes the assessment so far. And now the baby is on her back. We'll finish doing some measurements as well. So we will check her head. So we do it above the eyebrows and we'll put it around and we do measure. And that's around like 37 centimeters. And then we'll also check the baby's length. And this is around 27 inches or so. The baby is around 9 pounds. Well, the baby was weighed today and is 9 pounds and 8 ounces, which is a normal weight for a 1 month old infant. So, overall, the assessment shows that she is a healthy 1 month old or 4 week old female. We will continue her routine feeding schedule since the infant is at a healthy weight and there are normal wet diapers and there's normal stooling patterns. We'll continue the safe sleep practices and tummy time while awake and the baby is being supervised. We will have the infant follow up in 2 months for her 2 month well child visit. We'll make sure that the infant um, is continued to be assessed at home for any jaundice. So we do want to make sure that the skin and the eyes are not yellow or appear yellow, or the infant is feeding poorly or is lethargic. Another sign the mom was advised to look out for was decreased diapers. So either decreased wet diapers or stooling even. Mom was reminded to seek a medical evaluation if any of those symptoms occur. We will also follow up with Penny at the 2 month well visit for some updated immunizations. Um, Penny did receive the hepatitis B vaccine at birth, along with, um, I'm sorry, so at the 2 month visit, we'll include the hepatitis B number 2, we'll include DTaP, that would be the first one. We'd do HIB, which will also be the first one, and a pneumococcal conjugate vaccine number 1, and an IPV vaccine number 1 as well. The infant tolerated the exam well. The infant will be reswaddled and safely returned to her mother, and mother verbalizes understanding plan of care for Penny, and of course, we answered all the questions. Thank you so much.